you are still in the induction period, trying to articulate your vision to them. And so far, I'm sure, as quickly and as early as we find ourselves, people have understood the vision. And so they've done very well, and then they flow, they carry themselves very well. And I'm sure so far, I think we are still trying to get
Okay.
there.
You sound like you're still in work mode, so I want to take you out of work mode, Doc. When you want to relax, what song do you listen to? I want to take you out of work mode right now because you really sound like you're still in the work mode and then you're tired. When you want to relax, what do you listen to?
Well, if you ask me, if I don't know.
Doc, I have asked you.
Yeah, you've asked me a question. I like a lot of, but I'm trying to think of the ones that will relax me after work.
Yeah.
Because normally I get so tired, I hardly get the time to listen to music or anything. But
maybe you should go back to when you were much younger.
You know,
the songs that you listened to when you had time. So which one would it be?
Well, I used to like, the songs from UB40.
UB40.
You remember?
Oh yes, of course. Yeah. Unemployment benefits.
That's it.
Okay, I think I should do one very calm UB40 for you. Would that work?
Yeah, it will.
Okay, I will. Well, let's. Yes. We need to get him in a very relaxed mood. He's still in work mode. About you. Let's get to meet you. We're interested in where you grew up. Where are you from? If you can share a bit of us with where you hail from.
Well, I come from the Eastern region, specifically Oboko, but my parents stayed in Koforidua.
Okay.
So that is where I have my uncles and aunties, as well as my mom.
That's where you grew up too?
No.
Okay.
I grew up around this environment. Kokomemle, Asalam Down, Adabraka.
Oh, so you're very familiar with this neighborhood?
Very, very much.
From Fanofa to wherever?
Very much. Very much.
Why? What were your parents doing then?
My mother was a teacher.
Okay.
Yeah, she used to teach. When you go into UTC, there's a cluster of schools on the right side.
Right.
She taught there until she retired. And so we used to stay originally in Adabraka. We moved to Asalam Down. And then I went to stay with my uncle in Takrade. Eventually, we came back to Accra and we're in Kokomemle. So I was in Kokomemle till I entered the university.
Why did you have to go to Takrade?
Well, he was an Air Force officer, and so his job took him to Takrade, and I was staying with him.
But what was your father?
Well, I grew up with my stepfather.
Your okay.
Yeah, right.
Okay, so you had to move in with your uncle.
Right, yeah.
I see.
That's what happened.
So, did the Air Force bit rub off you in any way?
I owe everything to that because your discipline and your call to order and everything comes from the barracks.
Wow.
Definitely.
Yeah.
When to wake up and then when to start your day, when to sleep, and then the orderly way of doing things. So I'm very grateful.
You never went wayward?
Well, you will, because when you are in secondary school, you know what happens.
No, dog, I don't know what
Yeah,
happens. You
maybe
tell me
like
what
you
happened.
can tell me. Yeah, I mean, the peer pressure is there.
Yeah.
Can distract you a little bit.
You got into trouble somewhat?
Well, I never actually went into any kind of trouble like uh, in my O level days.
Yeah.
But I remember sixth form once I was late to assembly and I was asked to go and weed the school farm.
Yeah.
And
Well, then you were fairly good.
yeah, I mean, really.
Yeah.
But we were part of the troublemakers, but we were never caught anyway.
Oh, okay. Which school was this, though?
Well, I did my O level in St. Peter's Secondary School, 1 to 5.
Okay.
And then I went to secondary St. John's
Right.
for my sixth form.
I see.
Right.
Where were you heading when it comes to career? Were you always passionate about medicine?
Medicine? Well, I know, but something happened. Probably that was what defined my vision.
Mm.
In St. Peter's Form 1, St. Peter's used to have the zoo where we have the baboons and the snakes and whatnot. But I was bitten by a baboon in Form 1, 74.
Really?
So I was taken to a TVA government hospital in Kwao. And then there was this white doctor from America. It was then run by SDA, so they were Americans. And I loved the way the man spoke to me, treated me, nursed my wounds. And I told myself that, should I become a doctor, I'll come here and work.
Wow.
So I became a doctor and went there and worked for 10 years.
You're serious?
Yeah, I did.
That's impressive.
Yeah, I walked through ministries and I requested to go to a TV. And I was sent there. And for the next 10 years, I was there. And that's what built my capacity. In addition to the knowledge that you have acquired as a doctor, then you come in touch with the poor, the needy. And you can never become a good professional doctor when empathy and passion are not part of your attributes. And that is where you see it. Because you then learn that both the rich and the poor all have the right to live. And poverty is there. And you recall in the night, you sometimes have to operate throughout the night and come back in the morning and see you have 120 patients. That was what you do. And after that 10 years, I was so confident. And then that was the beginning of my career, and they came to the next stage.
So your first posting was to a TBA?
Yeah.
Where the baboon took you first?
Yes. The baboon took me there in 1974, and I went back there in 1992.
Wow. Impressive.
Yeah.
You talk about the empathy bit and poverty and coming, in contact with it. Are the young doctors learning some of these?
Well, I don't know, but if you stay in the community and your door is knocked in the middle of the night, you should know that you are going to have to save life. And you see it almost every day. And the community is like that. When you reject them, everybody hears about it. That we call the doctor, he refused to come. And so you are not forced to, it should become part of your life.
Yeah.
That you have to help the community. And then unfortunately, or fortunately for me, my wife was a doctor too. So we were working together. And when she's on duty, it's like I'm on duty because she has to take care of the kids. So I spent almost all my time in the hospital, her duty and my duty.
And your duty as well.
I was there. So really, that was where it all started.
Is that what they mean when they say that being a doctor is a calling?
It is, unless you don't want to care. But really, you can never become a good doctor if you are not a good person.
Yeah.
Because a good person or a good leader must first of all be a good human being. And the knowledge doesn't mean anything. If you have that feel for the needy and add it on to your knowledge, then you become a whole professional. And I think going to the community builds that kind of addition to your knowledge.
Okay. So what made you leave Etibie?
Well, Etibie gradually became the best managed district hospital in Ghana. And all hospitals came for a steady tour, including Kolebu and others. And Trust Hospital even came there. And so Danida carried a program, quality assurance in healthcare. So I fortunately got a scholarship and went to UK. And then I did my master's in hospital management in Leeds. I came back and I was posted to Cape Coast in Tibetan.
Yeah.
It was also new, just like UGMC. We built the place. It became also the best regional hospital. We started the medical school in 2005. And then I joined SNIT in 2006.
Interesting. And you were at SNIT from 2006 till when?
2018, 12
to
years.
2018, when you were appointed the CEO of the UGMC.
Yes.
Wow. You sound like you enjoyed the management more than the practice itself.
There's a thin line between the management and clinical practice.
Is it?
I mean, you can have all the inputs, but if the processes are wrong, the outcome is also bad. And so what does it mean to become the best clinician, but the organization that takes into consideration the perspective of the various stakeholders, that is the providers who are providing the service. What are they looking at? Those who are coming to get the service, what are the perspectives? And those who are managing, what are they looking at? These are things that give the best outcome. Every sick person wants to be seen very quickly with respect and dignity. That's what they are looking at. It's not about your building. They are traumatized. They come to you. They want some respect. And those who are providing the service, normally we forget about them. Because the clients who normally complain that, the nurses are disrespectful, the doctors are... Nobody wants to look at the perspective of the providers. What are their capacity, their technical know-how? You are asking them to perform a task, but we are not identifying the gaps that they also have. It is when we have harmonized these two perspectives that we get the best outcome. But somebody must manage this.
Yeah.
It is not all about diagnosis and treatment. It is about also trying to identify the dimensions of quality care that makes that satisfaction for the people coming to access care and those who are providing. What does it mean when you see 100 patients and 80 of them die? You are not efficient, you are not effective. So we managers must make sure that the operation is efficient and effective. When we talk about effectiveness, it is the outcome. How many people get well when they came with their problem? It is not those who came on Monday, came back on Tuesday and Friday, and you think you are efficient. No. You are seeing the numbers, but you are wasting everybody's time. So when you talk about the hospital, there's a thin line between the management and then the clinical side.
Yeah.
If it is well managed, you get the better and best outcome.
You've had the best of both worlds.
Yeah.
Which one do you enjoy doing?
Well, I think I'm enjoying what I'm doing now.
The management bit.
Yeah, because you're still working with the clinicians. You have to appreciate them.
Yeah.
And they also see you as one of theirs, but you have an additional qualification that makes your perspective different, appreciate things different. You are organizing resources, mobilizing them and deploying them appropriately. How do you understand what the people are asking for unless you are technically competent to appreciate what they are saying?
Yeah.
Otherwise, you are always in a conflict zone. And you need to have a very harmonious environment that is respecting the people working and then also satisfying the clients who are coming for service. And this must be organized.
Tell me about the lessons from managing a TV hospital to and how different they are
now
from that of Trust Hospital.
Well, a TBA was a district hospital, and I always say mortality was somehow high at the time, and it was not to say it was the fault of the doctors because they were not competent, but there were flaws in the processes. The doctors were living a little away from the facility. They all had big dogs in their houses. The place was dark, and so when mothers come in during 12 midnight, the earliest the nurses can contact a doctor was early in the morning. So what happens between this time is all about their initiatives and then the death. So I approached Valco and then told them my story. They gave me an ambulance. And so the ambulance could cut the doctors from their homes. I appealed to the community. We get the street lights from the hospital to the last doctor's bungalow. We give them intercom telephone, and the mortality was almost zero.
Wow.
So it means it has nothing to do with competencies, but it has all to do with the process. That is the managerial aspect that somebody must think through and then bring it to bear.
Yeah.
And it was interesting and documented. And that was how I was able also to get the opportunity to train. And when that story was successful, my passion went more there. That somebody must manage. Somebody must manage. But that person must also have the technical know-how to appreciate what the practitioners are saying.
Yeah. Your area of special interest is quality assurance, where you trained quality assurance in healthcare. And indeed, we can't overemphasize the importance of total quality management, even in every organization. Now, isn't there a gap in quality assurance in healthcare delivery in Ghana?
Well, you cannot generalize, but I'm sure every organization must have the quality assurance that is continuously monitoring the processes, the data, and then identifying your flaws and using those flaws as inputs for correction continuously. It is never a one-stop thing. It is a process that must be done. And the clinical assurance part cuts across all areas. When you talk about the clinical side, the clinical audit, what are the mistakes that we do in our practice? What are we learning from these mistakes and how are we correcting them? The managerial aspect, all aspects. And so you should have key performance indicators that cut across, that you use to measure what the outcomes are. And so you should have a knowledge of what the trade is about, develop your key indicators and monitor them, and then see where you can correct them. I think these are areas that people don't emphasize, but it is key. I'm sure, Lexis, you have a way of assessing yourself here. And definitely, if you're just doing the work without taking time to assess the gaps, then you'll never improve. And it's all over in the industries. It's not only in healthcare.
In which of these is it more efficient, public or private hospitals?
Well, some public hospitals can be efficient. When we talk about efficiency, what are we looking at? I mean, for me, I define efficiency, to be more of the inputs against outputs, what you do.
Yeah.
But in hospital, let us look at the effectiveness more. That is the outcome of care. I mean, the outcome mostly are morbidity or mortality. I mean, if you are doing well, when people come to you and doing the right thing the first time, is the quality care. Because if your diagnosis is wrong, your treatment is wrong, your laboratory investigation is wrong, we are wasting everybody's time. But to you, you have seen 100 patients, but somebody monitoring and having key indicators to monitor will know that you are not efficient.
No, I understand, but isn't there the assertion that private hospitals are better when it comes to quality assurance?
Because probably they can hire and fire easily. That's against the cumbersome nature of having to go through processes of disciplinary committee.
You think that is the reason?
It's not necessary so, but private. I'm sure Lexis, this is a private company.
Yeah.
Yeah, you were supposed to start this program at 7. If you came at 9, what happens?
There's an issue.
That's it. It is. And the manager here doesn't have to answer to anybody getting you out here. So probably that makes the difference.
Okay. Let's talk about your efforts to fight COVID-19. Well, not just you. Let's talk about Ghana in general. How have we fared?
Well, I think we have done very well. I mean, if you watch television and saw the developed world, the challenges they went through, and the death that they counted, really. In the beginning, we thought we were all going to die, honestly. But so far, I'm sure it has been managed well, because all the 295 patients we've seen, nobody paid a dime, which means financial never became an hindrance for people to access care. Because if they had to think of money, it means they will stay in the community and spread the condition. So it's a big plus that people came in, they were treated, they go on the ICU for weeks, big bills, and then they wake up and go home for free, which means it never came to a point where people thought that I don't have money, so I cannot access care. And I think that one must be commended. And because of that, we were having almost 30 patients in our beds every day. As I speak to you, we have about 8 now.
Oh.
And then, 3 in ICU. So the numbers is telling us that something good is happening.
Generally, the numbers, the cases have dropped. I think the last report I saw, we have less than 1,000 active cases. Yeah. What do you think has helped this fight?
Well, I think self-awareness. The beginning, we're taking a lot of things for granted. But I'm sure with time, we have all been very careful. You realize that even now that we have open social gathering in terms of funerals and things. Once you go, we don't spend too much time like we used to do. You know, people, life is never the same anymore. I mean, personal hygiene has improved. We are washing our hands, sanitizing, social distancing, and so really, implicitly, we are doing things different from what we used to do.
Impressive. If you're just joining me, I'm spending time with Dr. Darius Kofi Osei. He is the CEO of the UGMC, and we're talking life, COVID, and UGMC. So I would think that the pressure on you and the UGMC has reduced drastically.
Yeah, it has. But we also, UGMC is not meant for COVID. We're hoping that the newly commissioned infection center will take care of COVID patients.
Okay.
UGMC have a bigger objective. We are supposed to do research, training, and then service. I mean, it's a quaternary center where we are preparing ourselves to take care of subspecialties. That is the quaternary. And so we are still working towards that bigger objective.
What is the quaternary?
Quaternary is above tertiary.
Okay.
The tertiary is the teaching hospitals that we have, Kolibu and others.
Yeah.
We have gone beyond the generic to subspecialties. Now, we used to have general surgeon. Now we have the surgeon in charge of the liver, the surgeon in charge of, and so now people are specializing.
Okay.
Yeah. So that is the quaternary aspect where we are looking at.
Okay.
So really, we have done a lot. We've started some services. We're doing obstetrics, gynecology, antenatal, and all the rest, family medicine, surgery, and others. By April next year, the second phase will be done and will be fully in operation. So the COVID, I don't want us to brand UGMC as a COVID hospital.
Yeah.
It's a stopgap, and we thought with the situation improving, we will have to identify ourselves and then move on to work towards that vision.
I'm just a little curious though. During the COVID era, you mentioned that you were there almost every day.
Yeah, I was.
How many COVID-19 tests have you taken?
Myself?
Yeah.
Well, I think some time ago we had to do all the frontliners, and then I took part. But after that, I didn't do any.
Really?
Because, well, I'm there, but I'm in my office. I have the dashboard.
Okay.
I'm not. I mean, I have to provide the logistics and safety measures for the clinicians to work, and you have to be there for them to bring their problems and you solve them. So, I mean, if you have delegated the functions appropriately and the team is good, you don't have to be there.
Okay.
Because then it means you are trying to take the job of people who have been trained to do certain things.
Did your family understand this?
They have to, because I was called to.
Yeah.
But the challenge was when you get home, you have to stay a little further away, and then, the troubles, and then the psychological, things that goes with it. But now we are all used to it.
In all of this, what did you learn from the pandemic?
I've learned a lot that in times of crisis, if we organize ourselves well, we can always overcome, because we are not expecting a COVID at all. And the way, it started with 2 cases, and then, it was scary, I'm sure.
Yeah, it was.
And we thought we were going to be overwhelmed. And the way we were able to organize ourselves and then meet the challenges that came. In fact, I'm very impressed that there is something good. And if people are managed properly, you can always get the best out of them. And so we should always not condemn, but try and then identify the strengths and weaknesses of individuals and appropriately manage them in times of crisis. We're able to do so, and let people also understand the vision. And when the leader, you don't know where you are going, definitely then you don't expect anybody to follow you.
Yeah.
You should be able to have a clear vision and articulate it properly. Because when you're asking people to perform a task, then you must be able to define the task properly to them. And I think in this case, we succeeded in doing that. And that is the story and then the outcome that you hear.
Right. Now, let's talk about you for a minute here. I want to know what you think has made you successful at managing all these hospitals that you've managed, from TB to Interburton to the Trust Hospital and now to the UGMC. What personal traits?
You're a very humble person.
Humility.
And then I respect people around me. I have never underrated anybody at all. And that is very important, because when you are working with this high caliber of persons, doctors and consultants, then you must learn how to give them that respect for them to be able to work with you. The moment you lose that, then we will have a lot of confrontations that doesn't augur well for any success. And so you must be a good listener, and then you must also understand your work, because when you don't understand your work, you are intimidated, and then you become very confrontational, and then nothing gets done. I think the success story is that I'm ever learning. I want to understand the job to the point that when my people come to me and want to discuss how to move ahead, I will appreciate the discussion, and then we will always bring that consensus and move on. And for me, I think that's the success.
Wow,
nothing extraordinary.
Yeah, I've learned a lot from you this evening, honestly, and your humility stands out, and I need to say kudos.
Thank you.
And congratulations again.
Thank you, Lexis.
I need to meet your family as well. Tell us about your family. I'm sure you.
Right.
Yeah.
My wife is a doctor. She is the director in the research in Ghana Health Service.
Okay.
I have 3 daughters.
3 daughters?
Yes. My first daughter is a doctor in the U.S. The second one is a pharmacist. And then the last girl is a voiceover artist and a script writer.
Is it?
And I want you to invite her and probably try her.
I would love to.
Yeah,
how old is she?
She's 23.
Wow.
And then she just wrote her professional law exams. She want to enter the law school, Ghana School of Law. So
that's impressive.
3 girls and then my wife. So I'm the only male in the house.
You must be lucky, man. That's why you're looking this good.
The luck will come when I start collecting
the bride price. You're looking forward to it. You've not started yet, eh?
Well, hopefully soon.
Hopefully soon. Awesome. If you had any advice for young people who are listening to us this evening, what would it be?
Well, I was just discussing with you that to be successful leader, it doesn't come easily, because some of us, from the story I'm telling you, means that we have really built our capacity from the scratch. Moving from the periphery, right in the community, through to the region, to the center. 30 years of my practice, 22 years of it has been in management positions. You learn every day. The experience you acquire, that is the skills and your initiatives adds on to the knowledge. And you need to be patient and buy your time.
Yeah.
Because you can have a vision, but you should work towards it.
Awesome.
And working towards it means it's not a year or 2. It can take you 10, 15. If you are distracted by other things, you go away from your vision and you start all over again.
Okay.
Consistency is needed. And then you must be humble and then respect people around you.
Humility is very important. I might just have received the message that will get your last daughter a gig.
Oh, yeah?
Gifty Auntie Awo Dansoa.
Yeah.
She just sent me a message that she would like to meet your last daughter.
Yeah.
Yes, so we probably would get her doing some voiceovers for Gifty Auntie or something of the sort.
I mean, you like her.
Yeah, all right. So I would arrange so that his last daughter gets to meet you, and we see how good she is, and probably she could be the next Gifty Auntie.
Oh yeah,
yeah.
I wish so.
Thank you so much. It's been great spending time with you, Doc. I'm so impressed, and a lot of people are full of praise for you and your team at the University of Ghana Medical Center, and we say thank you for all the lives you've saved in this COVID period, and may God protect you and the team as well.
I'm grateful for having me and giving me this opportunity to share my story.
Awesome.
I mean, very soon I'll be a pensioner. I'm very happy to be here.
And hopefully I'll be there when you are collecting the bride price too.
Yeah.
I'm looking forward to it.
Yeah. Maybe I'll be collecting it from you.
I'll help you arrange the boxes in the house. I'm Lexis Bill. It's been such a great evening with Dr. Darius Kofi Osei. He's the CEO of the University of Ghana Medical Center. Very impressive story. And we say kudos to the team as well at the UGMC. Uncle Ken will be on your radio shortly with Ken's Music Mix. He's got a real good catalog he's going to share with us this evening on Joy 99.7 FM. Right after Gifty Ando Apia shares with us what's happening in news. I'm Lexis Bill. Thanks to my team, Adam Naite, Philip Nye, Abeku Sakofiso, Nofori, Anita, and Mirabel. And go in tomorrow at 3 o'clock. I'll be back.